News time is 8 minutes after 8 o'clock here on this Wednesday. Thanks for being with us this morning from the newsroom of Regional Radio and DeWittDailyNews.com. I'm Seth Lawrence with this expanded local newscast, streaming to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. The DeWitt County Genealogical Society is hosting a workshop at the Warner Library next Saturday on techniques for DNA test results. On the WHOW Morning Show Tuesday, President of the DeWitt County Genealogical Society, Terry Lemmel, told Regional Radio the workshop will help those who have gotten their DNA results and what they need to do next. She encourages those who attend to bring a laptop or tablet with them to follow along with some of the things she'll present.
And I'm asking people who attend in person to bring their laptop or their iPad so that they can bring up their own DNA matches and work through it with me as I show them one that I did.
Yeah, sure.
And then we're also offering it over Zoom. Mm-hmm. So if you want to attend in person, you need to call the library to register. Attendance is limited to 20 people. If you want to participate over Zoom, I need to be notified at the Genealogical Society's email. Notify me by the 14th. And then on the 16th, I will send out the Zoom link and digital images of the handouts. I have lots of easy-to-understand handouts. I'm not going to get real technical. I want everybody to understand what they're doing and to learn how to use the tools available on Ancestry for processing your DNA match.
According to Lemmel, there is a misconception she encounters a lot around getting your DNA results. She explains there's a lot that goes into getting the entirety of your genealogy reports.
Most people, it really can be complicated, and I think there are a number of things that, for example, a lot of people say that they got their DNA done just to find out their ethnicity. But it turns out that the ethnicity is such a random thing that unless you're in a group with a lot of endogamy, which is a case where people within a community intermarry for several generations. For example, Cherokee Indians or Ashkenazi Jews, Amish. Then in my case, I'm a real Heinz 57. My ancestors have been here since not long after the Mayflower.
Oh, wow.
So my ethnicity is so mixed up that it doesn't really tell me much. It absolutely requires some critical thinking because you'll get all sorts of hints, and some of them are way off base. My goal in getting my DNA done was to advance my tree. I like to look at other people's trees, which are often full of mistakes. So you can't just take what's in somebody else's tree. You have to look and see if they have sourced that information. Let's say, for example, I have a lot of ancestors who came from southern Indiana, but the county where they came from doesn't have stuff online, really. So I went there myself, and I found a whole bunch of stuff. And I added it to my tree on Ancestry, which then becomes a hint for others. But there's the source. You find it in someone else's tree and not through Ancestry.
Lemmel also points out the Genealogical Society has its own space at the Warner Library in Clinton and hopes if you're seeking to put together your family tree, you'll consider utilizing the resources they offer that can help. Find the DeWitt County Genealogical Society on Facebook or visit DeWittCountyGenealogicalSociety.com. RSVP for next Saturday's workshop by emailing Lemmel at DeWittCGS@gmail.com. A Central Illinois school district is joining many others by implementing a program that helps equip teens with the tools they need to deal with to deal with those and help those battling a mental health or emotional health crisis. Issues of mental and emotional distress have drastically risen in youth in recent years, and Warrensburg-Latham schools recently began implementing the program Teen Mental Health First Aid that several schools in Central Illinois have also introduced to battle the crisis. Principal of Warrensburg Warrensburg-Latham High School, Allison Nolan indicates this was something she was very excited to bring at the recommendation of Superintendent Cheryl Warner. According to Nolan, they survey students about where they are from a mental and emotional perspective.
One of the things that we do here at the high school and actually in all of our buildings is we survey our students to just get a pulse on how they're doing social emotionally. So we ask them, how do they feel? How connected do they feel to our school? Do they feel like they could have adults in the building that they can go to for help? And one of the other questions that we ask is what they've experienced in the last year. And so in that survey question, we ask them if they have had maybe depression symptoms or anxiety symptoms, also things like a loss of a loved one or thoughts of suicide, just a variety of symptoms that they might experience if they are experiencing a mental health challenge. So from that, we definitely see, I would say, what is comparable to what we know, research-based nationally. So about 1 in 5 students will experience a mental health challenge before they reach the age of 18. And so that is based on, what we have survey-wise from national data, but also I would say it's comparable to what we have within our school as well. So kind of based on that information, I feel that we are very fortunate to have this program to directly address then the symptoms that we're seeing within our students.
Adrienne Moody is the high school counselor and says they are currently in the middle of training students. Trainings helps students able to effectively talk to peers and know when to tag in a trusted adult.
The model that we chose to do is 3 sessions of 90 minutes. So every session we cover different topics. So we're in the middle of training our juniors right now. So what we've covered is just like an introductory. That first session was what is a mental health challenge? Mm-hmm. What is professional help? We talked specifically about mental health challenges that would be a crisis situation. Mm-hmm. So making sure all of our students can identify what is a mental health crisis, what is a substance abuse crisis, mm-hmm. and when to tag in that trusted adult. And then, so that is basically what the curriculum covers. Mm-hmm. So we are currently training our juniors. We've had our second week. This week on Thursday, we have our 3rd session for them, and everyone who's completed that will receive a certification. The message that I feel like this program really sends to our students that is that it's okay to not be okay, and when we're not okay, we tag in a trusted adult to make sure that we get the help that we need, because we know if we can identify early that we need the help and assistance, so we can get better quicker. And just instilling that hope in our students and, letting them know that they don't have to walk through anything alone. It can be kind of hard at times whenever you're going to a peer about a mental health challenge and feeling like you don't have the skills to, address that. I feel like we even teach our adults that within our youth mental health first aid and mental health first aid that we have out there.
The program will continue to be rolled out as more students get trained. Nolan says one thing they are trying to stress to students is oftentimes mental and emotional health challenges will roll into other areas of their lives, including academics. Get news anytime from your computer or mobile device at DeWittDailyNews.com.